They should have good familiarity with what their past medical history is. They should know what their significant illnesses are and have been in the past. They should know what operations they've had. That is a little bit of the homework the patient should do before coming to the doctor's office to discuss their surgery. And they should know what their allergy profile is. There are, so many medications that are used around the time of surgery, either in the preoperative preparation during surgery or after surgery, whether it's antibiotics, whether it's pain medication control, whether it's medication to control acid in the stomach or whatever. There's just a myriad of medications that are necessary. And obviously we want to avoid any of those interactions that would be deleterious to the patient's recovery and operation, and knowing what their allergy profile is ahead of time helps us prepare the medications that we are going to administer them to help them recover from their surgery. They should particularly know their medication list, and it's very helpful to have that written down so the surgeon can advise the patient which ones to stop, which ones to continue, which ones to even take the morning before they leave the house to come into the hospital, even though they'll be instructed in general to fast after midnight the night before. Probably one of the biggest items in the medication list is whether a patient is on some type of blood thinning medication, whether it be formal anticoagulation or in the way of antiplatelet type medication. It's really important for the surgeon to know that and not find that out the morning of the surgery and the patient forgot to tell him that, because it could result in canceling of the operation. So some of those medications need to be stopped several days prior to surgery, and it's best to know that ahead of time rather than too late. First of all, they should know that no question is a dumb question. Anything that comes into their mind they should ask, because what they're going to do is they're going to go home if they didn't ask, and then they're going to stew about it, and they're going to think, gosh, I wish I'd have asked it, and there's no reason to have that type of angst, and it's just better to ask the questions. But in particular, I think they should make sure that they get a good description of the surgery that's being discussed, what's involved in the operation. And that kind of goes hand in hand with that. I think it's very important that they ask the surgeon what's their personal experience with the operation. Is this something they do, reasonably frequently? I mean, there's some surgeries that are not done with a great frequency just because they're unusual types of operations. But still, I think there has to be a comfort level there with the experience of the surgeon, and it's a good question to ask. And patients feel like, oh, maybe I shouldn't be doing this, but they should feel empowered to do that because it's very important. One of the other items they should always ask about, if it hasn't been offered by the surgeon, is what are the potential risks? What are the potential side effects? Usually most surgeons will use that in the description of their operation and explain what the more common risks are. And then I think it's important, if the surgeon doesn't discuss it, is to ask, are there any alternatives to not having this operation? I mean, what happens if I don't have the surgery? I don't think patients should feel like they're going to come into the surgeon's office and feel like they're going to get a lecture. I mean, they should feel like there should be a dialogue, and that their contribution is every bit as important at the preoperative setting as the surgeon's contribution. And if both are forthright and both are informative with each other, then I think the output or the outcome is going to be a good one.